there's the old saying, Botox is never cheap, and cheap Botox is never good.
Yeah.
There's the truth to that. We're not a Groupon industry. This is medical. These are medical procedures.
They are medical procedures, and
they have complications.
And quite frankly, I'm sorry, but when I see somebody doing a super cheap deal on Botox or fillers, you need to find out who's doing them.
Right.
Because it's most likely a new injector that they're trying to stir up business for, and I've seen
the problems
that occur.
We both have.
You know, and with Botox, okay, your problems are minimal, and they're not forever. They're temporary.
Right. 3
You've
to 4
got
months.
a dropped brow or a crooked smile, but filler, those complications can be blindness.
Right.
They can be death. It's not good.
And also depending on the type of filler, you and I are both very loyal to fillers, which can be reversed. Meaning if something bad happens, you can inject something, it goes away.
Yeah.
There are some permanent or more permanent fillers that have to be cut out.
Yeah.
I mean, people will come see me with a lump in their cheek that has to be cut out. It cannot be reversed.
We've been in this industry long enough, we've seen those patients. You know, I've seen patients, I don't use those products, but I've seen the patients that have come to me having used those products that needed to be cut out, and now they've got scars and they've got indentations in the face that will never be corrected, and they were not always were they done by inexperienced injectors, but they were done by people that probably shouldn't have been doing them.
Great.
Yeah.
What's the biggest thing that you would like people to take away from our industry?
Probably the biggest takeaway in our industry, I think.
I mean, for me, it's education.
Education.
You know, there's the old thing for physicians: see one, do one, teach one.
Yep.
That's kind of how we're trained. Nurses are the same way.
Same way. Yep.
Nurses have trained me to do most of what I do. I have 3 people.
I love it.
That's help you do that. You'll do better. I'm like, that's not quite so good. But the reality is, that's what we do. And so I think educating people, these are safe procedures if done in the right setting.
Yeah.
It's perfect. Otherwise, go somewhere else.
Again, because they are medical procedures. Yeah.
Right.
No, I mean, education is huge. My biggest takeaway is do your due diligence in your own education on your provider and on your injector. Look at good before and after photos that are not just photoshopped.
Yeah.
Ask for the plastic surgeons before and after photos. I think that referrals are huge.
I agree. I think word of mouth is the biggest thing in this industry.
Mm-hmm.
I remember when I first started in practice, someone said, walk to the hospital, not in scrubs. Walk in as just regular street clothes. Talk to 2 or 3 nurses and say, hey, my mother just got diagnosed with something, who should I go to? Random people on the street will tell you the right answer. Yeah. Same thing in this business.
Yeah,
if someone says, oh my God, Kelly is the best nurse injector ever, you're going to go to Kelly.
Mm-hmm.
So I think word of mouth is our biggest
advertisement.
The world is not perfectly Instagrammed and Photoshopped.
Yeah. And I think that, I don't know, I have this weird thing. In your industry with plastic surgery, and I was thinking about this the other night too, if the plastic surgeon is the most expensive, it doesn't mean it's necessarily the best. Because I know plastic surgeon prices that are really, really high, and the plastic surgeon is not very good, but they're accounting for that person to have to come back and get a lot of tweaks.
Right.
You know what I mean?
Well,
but then on my industry, if the prices are really low, you're not getting injected by a good injector because it's usually a novice.
Right.
So it's almost like if yours is too high, be careful. If mine is just too low, be careful.
Absolutely. I mean, there's a price range for everything we do.
Mm-hmm.
I think the thing is you're exactly right. Kind of keep it in the middle range.
Yeah.
If it's too expensive or too cheap, right away.
Yeah, too expensive or too cheap. Yeah, agreed. Well, you know what? That's funny because when I was picking my builder for BeautyCo, that was what I was told too with my builders. If they're too cheap, run away. If they're too expensive, run away. You want to pick that one. And
there's a sweet spot.
They're builders.
Right.
We're builders.
We're good. We're building faces.
We're builders.
Too,
I mean, we're keeping people beautiful, one enhancement at a time.
Right.
Really.
We're just trying to help people rebuild their best self.
Yeah. So to wrap up, BeautyCo opens September the 28th in the new Wegmans shopping center. They're building a lifestyle center. There's everything for you from head to toe in this lifestyle center for both you, your family, your fur family, and we look forward to seeing you for all of your injectable and facial needs.
And Franklin Plastic Surgery is open in Cary, and we are open to see from head to toe.